ashe jinin mu ya zo daya kai kai wanki ni kwa in zo in dau tsintsiya san babu laya gangar jiki an ce zuciya in babu kai sai dai aji ni ba lafiya zan zo da bargo da ni da kai mu tare ciki dan babu randa ba za na kun a gefen ka ba
na baki
warai ina ta yin godiya
ko an yi yaki
asa ba za a kada mu ba
zama na duniya kuma a hankali ake yi san babu kuskure yace nake kira ta yayi.
I wish to call on Mrs. Ladidi Bako-Aiyegbusi mni. She is a former director of Nutrition Department, Federal Ministry of Health and Social Welfare. She is going to give us the keynote for this beautiful conference. Topic: championing hospital nutrition care, a vision for Delta State and Nigeria. Special guest speaker, you have the floor.
Mrs. Ladidi Bako-Aiyegbusi mni is one of Nigeria's foremost public health leaders, a scientist, strategist and systems builder whose work has shaped the nutrition and health outcomes of millions of Nigerians. After more than 3 decades of distinguished service, she retired from the Federal Ministry of Health and Social Welfare in December 2025, leaving behind a legacy that will endure long after her tenure. As the pioneer director and head of the nutrition department, she successfully led the transition of nutrition from a division to a full-fledged department within the ministry, a structural reform that permanently strengthened institutional capacity, governance, and national accountability for nutrition programming. Under her leadership, Nigeria achieved nutrition milestones that were in many cases firsts for the country. She developed Nigeria's first annual operational plan for health sector nutrition, expanded maternal, infant and young child nutrition services nationwide, revitalized the baby-friendly initiative and strengthened integrated management of acute malnutrition programs. Her contributions have earned some of the most prestigious recognitions in global public health. Time 100 Health Honoree 2025 for leadership in advancing food fortification to address micronutrient deficiencies and child malnutrition. Gates Foundation Goalkeepers Champion 2024 for her contributions to combating child malnutrition. 100 Outstanding African Women 2024 by the New Africa magazine. 2025 Director General Fellows List, West African Institute of Public Health. 25 Nigerians redefining leadership, culture and innovation in 2025. The Punch newspaper, December 2025. Mrs. Bako-Aiyegbusi mni holds a Master of Public Health, Health Promotion from Obafemi Awolowo University, a Master's in Cellular and Molecular Parasitology from the University of Ibadan, and a Bachelor's in Microbiology from Ahmadu Bello University, Zaria. She is a member of the National Institute MNI, Fellow of the Chartered Institute of Local Government and Public Administration in Nigeria, Member of the Chartered Institute of Directors, Nigeria, Honorary Member of the Nutrition Society of Nigeria, Fellow of the Institute for Dietetics in Nigeria, and Ambassador of the Dietitian Association of Nigeria. Retirement has not slowed her down. Mrs. Bako-Aiyegbusi mni is the founder of Living Well with Ladidi, a platform dedicated to promoting healthier lifestyles, preventive health practices, and community well-being. Through strategic advisory services, leadership development, advocacy, and public engagement, she continues to extend her life's work beyond the walls of government. Mrs. Bako-Aiyegbusi mni is married to Mr. Aiyegbusi, and they are blessed with children and grandchildren. Ladies and gentlemen, it is my pleasure to welcome
Mrs. Ladidi Bako-Aiyegbusi.
I am speechless. I love dancing. So when I got up and I heard that wonderful music, I wanted to dance. But I now quickly reminded myself that I'm here for business. But I was really shocked. I don't know how the team, Dr. Pams, I don't know how your team put this together. But please, I would like to have a copy of this. Your Excellency, the Executive Governor of Delta State, ably represented by Madam Permanent Secretary Ma, our dear Chairman of today's occasion, my dear sister, the President and Founder of WASPEN, our Chief Host, the CMD FNC Asaba. At a point in time, I was a supervisor. But today, I am here at your mercy. If you ask me to jump, I will ask you how high. My fellow speakers, the representative of His Royal Majesty, the Asaba of Asaba, policymakers present here, dietitians, nutritionists, the media, the researchers, the academia, the manufacturers, the regulatory bodies, development and implementing partners, everyone represented. I've been told that I have limited time, but I recognize everyone. I cannot stop this recognition. I cannot abide or stand or follow the established protocol without recognizing the grandmother of nutrition in Nigeria, Mrs. Beatrice Eloaka. I came into the ministry as a young scientist. At a point, our path crossed, and she taught me a lot about nutrition. When she was teaching me, I never knew that one day I will end up on the seat that she vacated. Thank you, ma'am. She saw far while I was seeing near. Distinguished ladies and gentlemen, it is a great honor for me to be standing in front of you today to give this keynote address at the 5th annual WASPEN Clinical Nutrition Conference holding here in Asaba. And I want to say a special thank you once again to the President and Founder and all the Executive Board members of WASPEN for sustaining this important platform, which continues to elevate conversations around clinical nutrition, patient care, health system strengthening in Nigeria, and also across West Africa. I sincerely appreciate my sister, Dr. Teresa Pounds, for not only making sure that I'm here, for ensuring my welfare. She made me very comfortable since I arrived. I think I'm the youngest retiree in this hall. Am I correct? No. I'm not 60. And I did not spend 32 years in service. I'm 35 years in service. I marked my 56th birthday about 3 weeks ago. So am I still the youngest? You know, throughout my career, at a very tender age, I was pushed into handling activity, organizing. This is the first time I will attend a conference, and I am not having palpitation, I am not sleeping, I am doing CGD, I am not checking the venue, because I must be at the venue the day before to check and everything. I have to wake up very early. I had rest. So once again, my sister, thank you. Today's subject is timely and essential, especially to the future of healthcare in Nigeria. Today I'm not speaking as a nutrition professional alone. I am also speaking as someone that was given the opportunity, the privilege to have spent about 32 years in the health sector of Nigeria. During those years, I contributed in developing and implementing health and nutrition policies. I coordinated quite a number of interventions, as was shown. For those of us that went to Kukuwa, we say as shown on the screen. Do we have any distinguished in our midst? Wow. Please, our dear chairman. Our Excellency. It's an experience that you cannot go and come back the same. It would be nice for our chief hosts to experience it with the kind support of His Excellency. Distinguished stakeholders, sustaining health programs like clinical nutrition is not built by policy alone. Rather, they are built through shared ownership, strategic partnerships, institutional commitments, and systems that outlive individuals. These lessons are things that are experienced firsthand. Clinical nutrition is not a supplementary aspect of healthcare. Rather, it is a core component of quality patient management, because nutrition influences every aspect of disease management, from prevention and treatment to recovery, rehabilitation, and long-term survival. So whether we are managing premature newborns, or critically ill or surgical patients, or individuals living with chronic diseases or vulnerable older adults, nutrition significantly influences the recovery, the complications, the length of stay in hospitals, the mortality, the quality of life, and overall healthcare costs. However, and I repeat, however, despite this growing body of evidence on the importance of nutrition, in health outcomes. Currently, as we speak, in Nigeria, clinical nutrition services in many healthcare settings remain fragmented, under-prioritized, insufficiently standardized, and inconsistently integrated into routine healthcare delivery. That is the situation as of today. So, this conference, I want to say again, thank you to the organizers, has brought together bright brains, bright minds, and strong voices in the different fields in clinical nutrition, in medicine, nursing, pharmacy, dietetics, academia, public health, health policies, and even the media across not just Nigeria but from West Africa to improve, to deliberate on how we'll improve patient care and advance clinical nutrition as an integral component of health system strengthening. So today, I invite us to reflect on the past experiences, on where we are as a nation when it comes to clinical nutrition services, and on where we must go. And there is this adage that says, if you want to go fast, you do what? You go alone. But if you want to go far, what do? You go as a team. So distinguished ladies and gentlemen, let's start by asking ourselves, are we going alone or together? Thank you. A round of applause for ourselves. So, my address, I'm going to critically look at 6 things. I will reflect on my personal lesson as a civil servant. I will reflect on the current landscape of clinical nutrition in Nigeria. Then I will highlight key major gaps that are affecting sustainability. From all we've been listening to, we are not at ground zero, am I correct? We are somewhere, but we need to move faster. And we've been told that clinical nutrition is not one profession alone. It is what? A teamwork. So I will talk on the roles and responsibility of the different partners. Then I will end with a call to action, because we will not leave this conference without agreeing on key steps going forward. So over the course of my professional journey, I participated in several things. For 32 years I was in health sector. I never went out of health sector on secondment. I came in as a young scientist. And out of those 32 years, I spent 16 in the management area. 4 years as assistant director, 4 years as deputy director, and 8 years as director. I gather a lot of experiences. And these experiences reinforce several important lessons that are directly relevant to the advancement of clinical nutrition services in Nigeria. 2.5 years to me exiting, I was posted to head the nutrition division. Then it was a division under family health department. And I was given 2 mandates. Imagine just sitting on a Friday in your office and you getting a posting letter. Has that ever happened to anybody here? Your Excellency, what was your reaction? Scary. Mine was more than scary. I was sad. Because I had a lot lot. Then I was the director of health promotion. I had a lot on my table. I just came back from Kukuwa, December 2022, and we were repositioning health promotion in the country. And this letter came. No notice. In fact, I had just finished speaking with the head of nutrition division. And immediately her call came. She called again and she said, she just got this letter. And I said, I have also reading mine. And I asked her, are you aware? She said, no, she was also about to ask me the same question. For the first time in my life, I don't manipulate things. I pick up my phone. I started calling every key stakeholder in health promotion. I said, this is what I got. Please, I don't want to leave health promotion. So, cut long story short, I never knew that God had some task for me to do. That happened August 2023. By November 2023, we got the departmental status. We were upgraded to a full-fledged department. By December 2023, I got my letter as the pioneer head of nutrition department. And for 2 years, all those laudable things that were rolled out on nutrition, I did not achieve them alone. I was only the driver. It was a team work. So from experience, I've just shared my personal story. Because we worked as a team, we were able to achieve a lot. Before 2023, nobody knew me within the international arena. If people knew me, it is what I was facilitating within the health promotion space. But within 2 years. So if we work together on clinical nutrition, I'm telling you, within a year, what we think is impossible, we will achieve it and even achieve more. Distinguished ladies and gentlemen, another lesson that I learned is that guidelines is very key in everything. And guidelines create structure and consistency. One of the strongest foundations of successful national health programs is the availability of clear national guidelines. Because guidelines define standards of care. It reduces harmful variation in practice. It improves quality assurance. It supports training and supervision. And it enables monitoring and accountability and strengthens continuity across institutions. Without standardized guidelines, implementation becomes dependent on individual experiences, local expertise, local preferences, or institutional capacity. And this situation will inevitably contribute to inequities in patient care. As we speak, multiple micronutrient supplements has been introduced into pregnancy care in Nigeria. I'm sure we are aware. We call it MMS for short. As far back as 2017, some countries have been introducing the pregnant women to MMS. But in Nigeria, in 2021, the government agreed, the government endorsed, and the national guideline on micronutrient prevention and control was revised, and it started the use of MMS into it. After that, do you know what happened? We went to sleep. Partners were doing different things. in January 2024, when we woke up from our slumber, and we came together as a team, government gives policy, government gives the protocol, government gives the standard, government gives guideline on implementation, but the actual implementation is done by you and I. So we came together, government and stakeholders, in January 2024. And within 6 months, we developed guidelines for MMS. We developed training manuals. Within a year, we had a roadmap. We developed job aids. We trained master trainers. We cascaded the training. And today, Google it, Nigeria is the first country. When did we start? 2020, that's when we started it in our guideline. Some countries started since when? 2017. Even in Nigeria, there are some states that started implementing MMS in 2017. But Google it today, Nigeria is the first country to institutionalize MMS in the world. That is what you get when you have guidelines put in place. Capacity building must be institutionalized. Short-term training alone do not transform systems. Sustainable progress requires the integration of clinical nutrition competencies into pre-service curricula. And that's why I'm really very happy that we have the representative of Pharmaceutical Society of Nigeria with us. We need to incorporate it into continuous professional development, structured mentorship system, multidisciplinary teamwork. Because clinical nutrition must become part of routine healthcare training service delivery, not an afterthought, but a core expectation. Another lesson is data. I learned that when you work from morning till night, Monday to Sunday, some of us we go to work on Sunday, am I correct? Especially with government workers. When I became an assistant director, if I have to leave Abuja on weekends, I must inform my immediate superior. When I became a director, I must inform my permanent secretary, because I could be needed, so they must know where I am. I love the private sector. Once it's 4 o'clock on Friday, what do? They shut down. We don't shut down in government. When I assumed the leadership of nutrition division before we transformed into a department, I realized we're doing so much, but our data management system was weak. When I say I need this data, how many children receive ready-to-use therapeutic food as of today? I will be told, man, let's call UNICEF. How many children are SAM? Let's call UNICEF. SAM means severely acute malnutrition. How many quantities of SPLNS do we have in the country? Let's call UNICEF. How many trained nutritionists do we have? State nutrition officer. Let's call UNICEF. And I said, why? If UNICEF, something happened to UNICEF today, does that mean we will not have data? Distinguished ladies and gentlemen, as I speak, we did not only ensure that key nutrition indicators are revised, because we have some in the National Health Management Information System. We refined them, we included new ones, and we trained. And those were some of the parameters that constituted the recognition that was rolled out. Because the world could see what that small department was doing. Nigeria needs stronger data system covering hospital malnutrition, nutrition-related complications, enteral and parenteral nutrition outcomes, length of hospital stay, mortality outcomes, cost effectiveness, and patient recovery indicators. We need this evidence to guide advocacy. The fifth lesson I learned was that collaboration is not only key, it is non-negotiable. In 2004, we had quite a number of challenges. Government has the responsibility to ensure the health and well-being of everyone, but the resources available are limited. So everybody, you have to come and do advocacy, and showcase why should your program be giving more than program B. We did the much we could as a team in the nutrition department. But with the support of stakeholders, weekends, you can Google it, weekends, Nutrition Department of Federal Ministry of Health, we were holding meetings. Not just anyhow meetings, stakeholders meeting, and we'll come out with concrete resolution that will be implemented. We were able to do that because of what? Collaboration. So for clinical nutrition, no single professional group can independently provide optimal nutrition care. Sustainable services require effective collaboration among all the physicians, the dietitians, nutritionists, the nurses, the scientists, the pharmacists, laboratory professionals, public health practitioners, hospital administrators. We need them. So, esteemed stakeholders, the future of clinical nutrition in Nigeria depends on all and how effectively we work together as a team. The second thing I'm going to talk about is what? Remember I said I was going to talk about 6 things. What was the second thing? The landscape of clinical nutrition in Nigeria. We have made quite a number of progress. That is the truth. We are not on ground zero, especially in nutrition when it affects infants, young child, maternal, adolescents, food fortification, micronutrient interventions, community, now we call it integrated management of malnutrition. Within the healthcare facilities, we are witnessing growing awareness of hospital malnutrition, increasing interest in enteral and parenteral nutrition, expansion of nutrition support teams, improve professional engagement. We want to say once again, thank you, WASPEN and related associations. There is increasing academic interest and research activity, stronger advocacy, and there is growing recognition of the importance of nutrition in every universal health coverage discussion. And we are seeing collaboration between hospitals coming up. Some tertiary institutions are beginning to establish structured nutrition support services. National Hospital in Abuja last year, they did that. Are there challenges? Yes. Although some protocols and standards exist, implementation remains uneven across the federal, state, and private health institutions. As a result, patient care often depends heavily on individual clinician experience rather than on nationally accepted standards. We have inadequate integration of clinical nutrition into health systems. Nutrition services are not yet fully integrated into the routine patient management, into hospital quality improvement system. In most facilities, nutrition is too often addressed late rather than proactively. We have gaps in workforce. We have limited number of nutritionists and dietitians. We have uneven distribution of the skilled professionals. And we have limited specialized training opportunities. When you look at the safety of patients, the absence of a standardized guideline contributes to patient safety risk. There is inappropriate feeding practices, poor infection prevention practices, incorrect formula preparations. When you look at the challenge of finance, many patients face substantial out-of-pocket costs for nutritional support. Enteral and parenteral nutrition products may be inaccessible or unaffordable, especially to lower resource settings. What about policy? We have some policies, but there is weak visibility. Clinical nutrition often receives less policy attention relative to other health priorities. Why do we need clinical nutrition guidelines? The development of an institutionalization of national clinical nutrition guidelines is one of the most important strategic opportunities for us to strengthen clinical nutrition services in Nigeria. Because the guideline is an instrument of standardization, quality improvement, patient safety, accountability, capacity strengthening, and health system integration. If we have a guideline, what will be the benefits to us? It will improve consistency of practice. It will enhance patient safety. It will promote better clinical outcomes. And it will intensify nutrition in every discussion of universal health coverage. And it will promote stronger capacity development. Distinguished ladies and gentlemen, in developing the National Clinical Nutrition Guidelines, what must we put in place? We must ensure inclusiveness. All stakeholders must be involved. No one should be left behind. We must ensure evidence-based. Guidelines should draw on global evidence and WHO recommendations, especially when we are looking at local realities. We cannot just adopt guidelines from WHO, hook, line, and sinker. When we get the global guideline, we contextualize it. Multidisciplinary framework. Clinical nutrition cannot operate in silos. And then scalability across levels of care. The guideline will address the full continuum of care. What should happen in primary, secondary, and tertiary health facilities, and even at the community level. Practical implementation of the strategy. Now, what are our roles? We say one person cannot do it. The government is to lead. The Federal Ministry of Health and Social Welfare will lead the development of the guidelines. The State Ministry of Health will implement and supervise the local government implementation. The professional associations will support in technical assistance and resource mobilization. The academia, we need more data, we need research. The academia, the training institutions should be proactive in ensuring that we have more data. The development partners are expected to collaborate with the government, and their collaboration should go beyond conferences. Development partners should support resource mobilization, knowledge exchange, but most importantly, all the support from development partners must be channeled in a way that builds local capacity and national ownership. The healthcare institutions, what must we do? We should establish nutrition support team. Please, let's appreciate those institutions that have done that. National Hospital Abuja, and I think LUT Lagos has also done that. And thank you, our chief host, because in your speech you mentioned that before we close, we will also inaugurate Asaba. Please appreciate our host. Distinguished ladies and gentlemen, the time has come for us to elevate clinical nutrition in Nigeria. The question is, what should we do? What action should we take? We must develop the guidance as a team. We must integrate into routine. And we must establish functional nutrition support team, not only the tertiary institutions, even the secondary. We must strengthen research, promote ownership. It's very important. We want to say thank you, WASPEN, for creating this important platform. I see in Nigeria where every hospital conducts routine nutrition screening and every ill patient receives appropriate nutrition support. Distinguished ladies and gentlemen, all that I have said is achievable. However, there is one thing that can stop us. What do you think? Sir? You say? Funding, commitment, leadership, advocacy is very key. As I round up, I want to go back to the central message, which is sustainable clinical nutrition services cannot be built through isolated efforts. Distinguished ladies and gentlemen, together as a team, we can transform clinical nutrition services in Nigeria. We can improve outcome and save lives. Let's use this conference not to be just another gathering, but a turning point in all that we do. In Nigeria, we know to develop guidelines, two of us. The guidelines will give us what to do, am I correct? When we collaborate effectively, collaboration will do what? It will give us how to do what the guideline says we should do. In the course of my introduction, I was said to have retired, but the founder of Living Well with Ladidi. It's a digital platform, and that platform aims to put on every door, every table of every decision maker, every household, simple things that should be done to ensure healthy living. So please, as the founder of the Living Well with Ladidi, I commit that I will work with WASPEN to ensure that where those information are gotten on institutionalizing clinical nutrition in Nigeria is well documented. The people have access to it. So are you also committing with me? So if you are committing with me, please bring out your phones. Bring out your phones. Bring out your phones. Bring out your phones. Go to YouTube. Are we all there? YouTube. Type Living Well with Ladidi. Living Well with Ladidi. Are you there? Did you see my beautiful face? Are we there? If you are not there, say no now. Second, subscribe. Subscribe. Distinguished ladies and gentlemen, I want to say a big thank you to the president and founder of WASPEN and all the board members for this opportunity, for consistently bringing us together to discuss. And I assure you, the outcome of this conference will get to the table of the coordinating minister. Because I am retired, but not tired. Thank you.
Thank you very much. Can we appreciate our keynote speaker? I think she needs a standing ovation. Noted, retired but not tired. That was awesome. I know she could go on and on and on. It is obvious that Nigeria is blessed. Women are blessed. Living well with Ladidi is blessed. Thank you very much.
I really enjoyed the session. It was a really great one, and I hope everyone here is following her and subscribe to our YouTube channel to expose us to. Right, that's one way to truly support her and the great job she did today. And this award is just a testament of her true prowess and her passion that she expressed with us today, and we are very grateful. And on behalf of the PSN President, Pharmacist Ayuba Ibrahim Talku, we want to give you this award. Thank you very much.
I want to say a big thank you. Thank you, my sister, the founder of WASPEN, and all executive members for this honor. This is the first recognition that Living Well with Ladidi founder will receive. Because Living Well went live on 31st of May. So I assure you that it is not the size, but it is what it will bring in collaboration. So thank you.
sauya kin zama soyayya kin haskake alƙarya ga ki irin alkunya yar yarinya tun mata ku yi koyin kwalliya gurin ta sarauniyar mata ga dawis sunanta ne